All right, everybody, welcome back. It's Dr. Pearlman here in Dallas, Texas, and we are going to show you what a regular checkup for an existing patient looks like. And I'm going to address a couple of things right out of the gates. Number one, why is this patient in a gown? Why would this person be in a gown, back exposed? Well, the reality is, if you're a new patient, certainly we want to get an actual visual of what your back looks like. We don't want to miss things like birthmarks, moles, potential skin tags or cancer, things like that. Like, number one, early on, especially new patients, we want to make sure they're in a gown. We definitely do not, or I don't gown, 100% of the time, 100% of my patients, but certainly we do early on. And here's another thing. If a patient becomes acute, now Jen over here works out every day, 6 out of 7 days a week, and every now and again, the lower back will get a little tight and a little flared up when she's doing things like deadlifts or squats. Don't you think it would be beneficial if I could determine what side, like here's the left side, showing inflammation, because the heat generation makes the swing this way with the scope, and if it consistently is going to show me that, then I know that down at those lower discs, those fibers on the left are bothered, or at least that's what's harboring some of the inflammation. So it's a great indicator for the chiropractor to go on that there is indeed swelling and inflammation generating heat, and I could see it better if she's wearing a gown versus me just guessing with the clothes on. So that's number one, or certainly without it happening, is a restriction and protection as the joint is beginning to lock down to protect that disc and those fibers and everything within the ligaments packed around the joint that's affected. So what we're gonna do is we're gonna make a structural correction based on that finding, and we're gonna go through that as well. How do we know it's L4? Well, biomechanics will tell us the laws. We palpate from the iliac joint up to L5, and we count up from there. We can wiggle the transverse processes. But the big thing when it comes to this adjustment is I'm actually trying to affect the left side. So I'll get into that in a minute without keeping Jen here for too long. You okay?
Yeah. Oh.
Okay. And breathe and just come face up and do some breathing. No, face up. Just come face up. Watch your head, okay? And just breathe. And in another couple of minutes, do some glute bridges. Here, I'm gonna record this too. I'm gonna have a seat right here. Hey Axel, what are you being a bad boy for? Boop. So a couple of things we're gonna talk about while Jen does some glute bridges. One is, if you actually watch the adjustment, I go down into the table, I don't pull the body off into rotation. A big portion of what makes an adjustment, a chiropractic adjustment in the lower back successful in a side lying position, which I don't even like adjusting, side lying, and that is, I'm gonna make a video separate to that. Please, people who watch this, comment in the section, in the comment section, leave some comments and ask why, or prompt me to make that video as to why I don't like adjusting in side posture. But for adjustments like that, when you do, if you use the leg kick and pull the body off the table, that induces a lot of rotation long term. That's something that I don't really like to do. But if you watch that adjustment going down directly into the table, the way I position my leg to her femur, which opens the joint, I do something called an Elvis leg prep. That then allows for what I call a window. That window of opportunity to drop and make the adjustment is how you're going to make the biggest crunch, the biggest cavitation is what it's called, that gas exchange or fluid exchange and the pressure gradient. And that's how she's going to feel much better, much more stable, much more stimulated in that lower lumbar region to be able to now do some exercises like glute bridges, because that's just it. The stability work following an adjustment is important for a lot of patients. A lot of people can do active therapy on their own. A lot of people are given exercises by chiropractors and therapists and everyone else alike, but it's not the chiropractor's job to keep someone in the office for 30 to 45 minutes to go through exercises that A, they can do on their own, or B, bill them extra money for stuff they just simply don't need, when in actuality, people go to a chiropractor oftentimes, or 99% of the time, what is wrong with me? Can you fix me? How long will it take? And of course, people don't like to talk about it, but how much will it cost? But again, probably better used for another video, but I certainly need to show what a checkup and an adjustment looks like based on lower back symptoms and how we can get Jen feeling a lot better. Jen, you feel better?
I do.
Well, come on up, move around. Let's see how you walk. When you woke up this morning, what was bothering you in your back?
My lower back.
Did you feel it, tweak it in a deadlift, or did you tweak it doing something else?
It was squats yesterday.
Squats, 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 squats. Everybody, squats?
Yeah.
Yeah. All right.
But yeah, much better.
Okay.
Much better.
Do you want me to check your neck, or are you doing okay?
Yes.
What hurts?
Behind my left eye.
Behind your left eye, Lopez?
Yes.
Okay. And that's the thing too, is someone like Jen, she has a hypermobile neck. We have to be really careful about where we adjust, why we adjust, how we adjust, how much rotation, how much lateral bending. What's more tender to the touch? 1, 2.
1.
Okay. So slide forward just a little. There you go. Nice and relaxed. Sometimes I think women may tie their hair, or even men with man buns, like a little too tight, you know what I mean? Like a little too tight. Yeah, that just set out. You okay?
Yes.
Still alive?
Yes.
Come on up.
When people say I'm looking for the right chiropractor,
Oh.
Like that? There we go.
There it is.